Good afternoon.
Good afternoon, everybody, and welcome. Welcome to our discussion today on mental health and critical race theory. Let me introduce who we are. I am Janice Berry Edwards. I'm a professor here at Howard University School of Social Work. With me, we have Professor Angela Wilbon, and she will speak.
Hello, everyone. Yes, I am Angela Wilbon, Professor Angela Wilbon at the Howard University in the School of Social Work, and I am in my final semester of my PhD program, and I am delighted to be here this afternoon with each and every. We have a short presentation this afternoon, and we certainly hope that you enjoy this presentation.
What we want you to know is that you can't be at the Mecca and not think about critical race theory and how it is essential for us to have in our lens as practitioners how critical race theory provides an incredible framework for us to understand and work with our clients, and also to educate others of the client experience in the framework of the clinical race theory. So, again, welcome. We're going to give you today an overview of critical race theory so that you can understand that framework. And while you're listening to this, think about how it applies in practice for you, whatever your discipline is. And we're going to talk about mental health and oppression. We think about mental health and oppression here at the Mecca, at the School of Social Work, from the principles of the Black perspective. We integrate the principles of the Black perspective, which is parallel to critical race theory, as a clinical practice framework. And then we're going to invite you for questions and answers.
As a part of our presentation, we welcome you to this imaginary place, this country called Amisa Terra. Amisa Terra in Latin means lost country. So we welcome you to Amisa Terra, and we'd like to introduce to you the country. Amisa Terra, the country that you are in right now as participants in this presentation, was a country that was founded in the year 1622. And it's been 4 years since its inception. And the country is populated by left-handed people, right-handed people, ambidextrous people, and the others. So if you'd be so kind, if you have access to the chat, to let us know if you are left-handed, right-handed, ambidextrous, or other. So please, we'll just give you about 20 seconds to let us know in the comment section, the chat section. And if you aren't able to contact, thank you very much. And if you're not able to put in the chat, at least let us just imagine and let us know sort of energetically, are you right-handed or left-handed? Okay, I see a few responses. I don't see any left-handed folks.
I was noting that nobody left-handed.
Nobody's left-handed so far from what we know. I'm certain that there are some left-handed people out there somewhere and some ambidextrous people out there somewhere. And we will move on. Okay, thank you, right-handed folks. Right, and so in the country of Amisa Terra, the laws of Amisa Terra declare left-handed people have full rights, privileges, and freedoms. Thank you, Dean. Ellis Dean, for your left-handed contribution to the conversation. And so in this particular country, left-handed people have full rights, privileges, and freedoms of the Republic. The laws of Amisa Terra state that any person in Amisa Terra who writes with their right hand is 3/5 human. The laws of Amisa Terra declare right-handed people are not allowed to vote in any political elections. All right-handed people must live in subpar housing located in food deserts. Right-handed people must attend separate and underfunded educational institutions. And these statutes continue. Right-handed people visiting health care clinics are only served once left-handed people are serviced. Right-handed people will earn 39% less than left-handed citizens. People who are ambidextrous, able to use their right and left hands equally well, will be considered right-handed writers with no exceptions. Those right-handed people pretending to be left-handed will lose all societal privileges if discovered to be passing. Any right-handed person having concerns or complaints regarding these laws must bring their concerns to a committee comprised of left-handed people. Welcome to Amisa Terra. And so we'd like to hear from people in the chat. What are your thoughts or feelings or experiences given the statutes that have been presented to you? Who would like to share? In the chat, let us know.
Don't be shy. Let's hear what your experiences are.
We had a right-handed person says, doesn't seem equitable. I got that. Thank you for sharing, right-handed person. Who else, if you will? Those of you with privilege, what's it like for you? Yes, we have a left-handed person say, it's fine if you're left-handed. We had a right-handed person says, doesn't, and maybe there's a additional thought to that. Doesn't seem right, doesn't seem fair. Please elaborate. For those of you who have shared, thank you very much. For those of you that we don't have the opportunity of knowing what it is that, thank you. Doesn't sound right to me. I hear you. I absolutely do. Thank you for sharing. And for those of you who are not able to share in the chat, we appreciate whatever thoughts and perspectives that you have about this conversation. Now imagine if you and generations before you were subjected to these laws for 400 years. Just imagine what it would be like. See, the United States and shaping America foundationally has been governed by statutes such as the ones that we see on the screen. Africans enslaved in America started in 1526. A statute governing, legalizing slavery in Massachusetts in 1641. Jim Crow era, 1876. Over time in the United States, there have been statutes that have been created such that we do have these differences in how people are treated, opportunities, rights, privileges that have been legally sanctioned. So when we think about critical race theory, it's a framework that examines and also critiques the United States history, our society, the institutions of power from the perspective of race. So it's a framework in which we look at race and we look at all of the inner workings of our society on the premise of that these statutes have existed. This critical race theory explores how race was constructed and its implications on our American society, race as a construct. And the theory also studies the potential link between the US legal system and racism. So what is it and where did it come from? Around 1970s or so, some lawyers, activists, and legal scholars, people such as Derek Bell, Alan Freeman, Richard Delgado, Kimberly Crenshaw, and many other scholars observed the advances of civil rights era of the 1960s had decelerated, it stalled or regressed. There was some noticing of the scholars noticing that there was the shift, there was this advancement, and then there was a deceleration of the advancements. And they started to question, well, why was that happening? What was going on? What were the dynamics behind this deceleration? And so this observation led to creating a theory or theories and strategies to address this phenomenon and the subtler forms of racism. And so critical race theory was created and built on two previous movements: critical legal studies or legal interminacy, and racial feminism, about power and construction of social roles. So that's foundationally where the theory was created. And basic tenets of the critical race theory are: racism is ordinary and typical, not an aberration. America operates with racism as a daily experience of most people of color. Racism is difficult to address or solve because it's not acknowledged. So we have these two phenomena, is that it is a part of the fabric of our society, and that because of the challenges and how much it's embedded and that we don't acknowledge it, how can we actually transform it? And then two, the interest convergence. The interests of Blacks, Indigenous people, people of color will only be advanced to the extent that dominant society's interests are advanced. So in order for all of us to advance, we have to acknowledge that there's something amiss in the way in which the society is structured and the way in which we have these statutes that support the oppression of certain groups of people. And so next, the social construction. Race and races are products of social thought and relations. It's a social construct. It's not biological. It's a socially created construct. And race is considered a convenient construct, dependent upon who benefits from the construct. Fourth, differential racialization or racial marginalization. Well, what does that mean? Dominant society racializes different minority groups at different times due to the shifting needs of the dominant society. Well, in essence, there was a time in which African Americans were being depicted as simple-minded because it fit what was needed at the time. If you think someone's simple-minded, do you have to pay attention to them? Do you have to listen to them? You can dismiss them, right? Seen as happy-go-lucky. Oh, that oppression doesn't really bother that particular community. They're fine because it fits the dominant society's conversation. And lastly, is that African Americans are content with servitude. And here recently is seen as menacing or a dangerous community. It fits within the agenda that's being promoted and pushed. Another example is Muslims being viewed as exotic before 9/11. And then once 9/11, now the new conversation around Muslims as a generalization, as a stereotype, is seen as security threats post 9/11. It fits within dominant societies' need to racialize and make these differences for their own advancement. Intersectionality. Multiple mutually reinforcing forms of oppression contextualized as a lived experience. So people are dealing with multiple levels and experiences of oppression simultaneously, concurrently. And then lastly, one of the tenets is the unique voice of color. All oppressed people having something in common, which is oppression, while also acknowledging that race is not monolithic. There's some overlapping experiences, but it's not monolithic. And then the themes of critical race theory is idealist as one. Racism and discrimination are matters of thinking, mental categorization, attitude, and discourse. It's a conversation, and that in that conversation, we need to change the systems, we need to change our language, our words, the images, how we depict people in our society, the attitudes that we have. The stereotype of, if an African American person is walking down the street and people grab their bag and bring their purse closer to them. We must change that conversation, the unconscious feelings, the unconscious conversations and beliefs, the scripts, and also how we teach people socially around race. So there's another theme, realistic or economic determinists. Racism is a means by which society allocates privilege and status. Is that there's this understanding that status and privilege will be doled out by race. And then materialists. Another thing, large segments of society have little incentives to eradicate racism. It's in the psyche. It benefits certain communities psychically, because if you demonize and dehumanize and exploit other groups for your benefit, so why would we want to eradicate something that benefits one group? And then another thing, revisionist history re-examines America's history from the perspective of minorities or people of color's experiences. Critique of liberalism, critiques of the notion of color blindness. Like, people walk around saying, I don't see color. Well, we have to really delve into that and look at that. What is that about? And look at the constitutional laws that exist that are perpetuating the oppression. This belief in equal treatment for all and post-racial society. So we have to look at that and re-examine, how are we approaching race in this society? And what are we bringing to the table that will create equality and equity? Structural determinism. The current system, by virtue of structure and vocabulary, how we speak, is ill-equipped. What that says is that we don't have the language at this time for us to be able to eradicate racism. So we must create new concepts, practices, and innovations such that we can move beyond the system that we have to create a new transformed system. So some people, not anybody here, some people may think, I didn't enslave people. I didn't write the laws. I do not oppress people. I see everyone as equal. I do not see color. Maybe there are people in the world, in our society, who might think this way and have this perspective. But I have a story about grandma's ham recipe. So there's a little girl and her mother in the kitchen, and grandmother is in another room. And as the mother is making this ham, she slices off both ends of the ham and places it in the pan. Her daughter says to the mother, Mommy, why are you cutting off both ends of the ham? And the mother says, well, sweetie, I don't know. I just did the recipe that way grandmother instructed me to. And so they call grandmother to the kitchen and they ask her, Grandmother, why did you cut off both ends of the ham as you prepared it? And the grandmother's response was, because I didn't have a big enough pan. We perpetuate things without understanding why we do it. And critical race theory is provoking us to look at things from a different perspective within our society, not just going with status quo. It helps us to shake up the narratives, the perspectives, the perception, the biases, the behaviors, and the civil rights and liberties. It helps us to look at these particular ways in which we're operating in our society and start to question it. Socrates quote, "The unexamined life is not worth living." Well, no criticism of Socrates. But what he wasn't saying like we should go all kill ourselves. That's not what he's saying. He's saying that we have a responsibility to look at what it is and how we're operating in our society and examine it. Not just go with the status quo, not just go along to get along. When we're living a routine and unthinking life under the rules of others without ever examining whether or not you truly want to live with those routines or rules, is basically not a life worth living. Not to be dramatic or extreme, but it's for us to really examine, how are we living? What rules are we following and why? So we have a video. We're going to show part of the video. If it's going, for some reason, Mr. Ellis, I might need your assistance. For some reason, it's not playing Dr. Barry Edwards, so we will move forward.
So how do we now move from thinking about the framework from the legal perspective, from the sociological perspective, and applying it in healthcare, and particularly looking at the mental health issues and racism? We all know that Blacks and Indigenous people and people of color experience overt and covert racism. And if you think about it, I'm sure you can identify in your life or in the life of others that you have witnessed their experience of overt and covert racism. We see that individuals are subjected to a range of personal assaults, denials, expulsions of opportunities, subtle and elusive personal injuries, slights, and even rude behaviors. These lived experiences cause an undue burden. They live within us. You don't forget them. The undue burden is parallel to trauma. And trauma lives within us. Trauma is settled in, from a neuroscience perspective, it's settled in the brain, in the amygdala, laying there for retriggering. So when we experience racial discrimination and injustice, it takes a heavy emotional toll. What it does is you triggered chronic stress. You experience stress, anxiety, and yes, depression, and trauma that's specifically related to the racial experiences that you have. And to the person in the chat, yes, this trauma, which we now know a lot about, is transmitted intergenerationally. Others who have been traumatized, such as those survivors of the Holocaust, they have actually, done some studying where they looked at the survivors of the Holocaust. And to make a long story short, what they determined is that how the internalized trauma of the Holocaust survivor has skipped generations and manifest in the skipped generations, I think it's every other generation, strong symptoms of anxiety and other psychiatric disorders. The same thing is true for African Americans and survivors of slavery. Those that have survived, those survivors of slavery transmitted through genetic DNA, through generations, the internalized experiences of what the slaves experienced. And it gets triggered. So that genetic DNA that makes you have a predisposition is ignited when it's re-triggered throughout your own personal experiences. And we don't pay enough attention to what that internalized experience all the way back to slavery, how that might speak to a number of issues within our community. Racism is a mental health matter because racism causes trauma. It causes significant trauma. I don't have to tell you, you see what happens. We've been watching it, and now we are getting very vocal about what's happening. We've had a knee on our neck for generations. And when we finally said enough, we made a move to address the knee on our neck. We have to address as clinicians when we see this oppression, when we see this racism in our clients and in our colleagues who are treating the other and don't understand the other. The trauma is powerfully significant because it leads to severe mental health issues. Now, the rates of mental illness in our populations are sometimes comparable or slightly lower than the rates in the white population. We often experience a disproportionately high burden of disability from mental disorders. For Black adults, they're about 20% more likely to report serious psychological distress than adult whites. The rates of depression are lower in Blacks and Hispanic people than in white people. Depression in Blacks and Hispanic is likely to be more persistent. So why are the rates lower? It doesn't seem statistically correct. It should be reversed. This has to do with how it's reported. Also has to do with disparity in access to healthcare where it would be collected and reported. So people who identify as being two or more races or more likely to report any mental illness within the past year than any other race or ethnic group. With Native and Indigenous Americans, they report higher rates of post-traumatic stress disorder and alcohol dependence than any other ethnic and racial group. Well, no surprise. Look at how they're treated. Look at what's going on reservations. Look at the disparity that exists with access to healthcare and appropriate healthcare where there's an understanding of the experience and the context of Native and Indigenous Americans. How many healthcare providers are Natives and Indigenous Americans? Cultural incompetence of healthcare providers contributes to underdiagnosis and misdiagnosis of mental illness in our community. And I mean, it is serious. Their own cultural bias contributes to how they see the client. Their own developmental experience provides a lens for them where they block out. They don't see it. For years, African Americans were never diagnosed with bipolar affective disorder. You know why? Because they thought that we weren't smart enough. We got the diagnosis of undifferentiated schizophrenia, which is a trash bucket diagnosis. Because most of the healthcare providers that were diagnosing them, they knew nothing about the context of the experience of the African American. The rates of mental illness in our populations are sometimes comparable or slightly lower than the rates in the white population. We often experience a disproportionately high burden of disability from our mental disorders. The experiences, if you look in the context of their experiences, it speaks to how the intersection of the environmental, where you see an outpouring of how their situations, how they experience covert and overt racism, contributes in a way that it is arresting and provides, or serves rather, as shackling experiences, leading or culminating in a disability. Black adults are 20% more likely to report serious psychological distress. This shouldn't be surprising. The rates of the depression are lower, and we kind of talked about that in a previous slide. We're going to move forward. We're going to continue to move forward. Now, critical race theory has evolved over time, and it really does provide a framework for an analysis of power in a multicultural space. So what am I talking about? The analysis of power in a multicultural space. When the other is different than the client. When the prescriber or the provider is different than the client who's seeking to receive services. Who has the power? The client doesn't have the power. Critical race theory also states that racism and discrimination are matters of thinking and mental categorization, attitude, and discourse. So these matters of thinking can hinder contextualization of harm and dysfunction resulting from racial stratification. So what are we looking at here? We're looking at providers who are the other that do not understand or appreciate or consider into as important factors of understanding the range of that client's experience. Their experience as being Black. Their experience in being powerless and the other. So in our work as social work clinicians, as well as in your work if you're outside of the discipline of social work, we are more often than not dealing with otherness depending on where you practice. But here in the Mecca at Howard University, the school where we have the School of Medicine, where we have the hospital, and in other wards, 7 and 8, and those wards that experience marginalization and oppression and lack of access and lack of providers, we're dealing with the other and their experience. Frantz Fanon, and if you don't know who he is, he's a famous Black psychoanalyst. He wrote Black Skins and White Mask. He spoke to this understanding of otherness when he said there is the moment of being for others, ontology, and it does not permit us to understand the being of the Black man. So for not only must the Black man be Black, he must be Black in relation to the white man. And this manifests in the diagnostic arena when the other is not the Black man. And the other is somebody that looks at us with curiosity and misunderstanding. Fanon strongly articulated that racism and white privilege exist within societal power structures, including social, health, and psychiatric institutions. So in this existence that impacts mental health care and render severe consequences on healing for those patients of racial difference. From the very beginning of contact and conceptual formulation in diagnostic thinking. What does that mean? Giving them diagnosis that doesn't apply, that doesn't factor in the realm of the experience. And practitioners in my discipline, we look at the biopsychosocial, physical, environmental, and spiritual context of the individual that presents to us. Next. So, the practice of social work, psychiatry, of mental health professions such as psychology, psychoanalysis, counseling, and even in acute care, they have the potential to systematically discriminate, and it starts with what there is in their lens, how they see the other, how their position of privilege blocked any conceptualization or understanding of being with the other. Many of them may not have ever been with the other all the way through their educational experience, to include graduate education, until they got into the clinical setting. So, according to Fernando, persons of color have experienced institutional racism in their past and present practices, and with clinicians' underlying philosophies on the state of mental illness. The specific mental illness labels, such as diagnoses and treatments, apply to racial groups and oppressed populations. The overrepresentation in mental institutions of these populations are clear indicators of a racist and pervasive culture that permeates our practice. And we have the power as practitioners to address this, eradicate it, and make sure that we don't swallow our voice when we see something wrong. For example, if somebody comes in my private practice and they carry a diagnosis that I know is wrong, and I have an understanding that that provider that diagnosed them and labeled them for life was the other. It happens a lot. And this is very serious, because in psychiatric disorders, individuals that are not clinically understood from a culturally intelligent perspective, they end up getting medicated when they don't need medication. They may need to be with the other to work through, in psychotherapy and behavioral therapy, some of the acuity that they're experiencing, to be strengthened, to be affirmed. These are principles of the Black perspective. So critical race theory can become a clinical tool. We can use this framework in an ethical, anti-oppressive, and social justice manner. So when we integrate critical race theory in clinical practice, doesn't have to be social work, but across the disciplines, the practitioner can develop a lens to understand how the Eurocentric, ethnocentric, and individualistic ways in which mental health practices are undertaken and have impacted clients of color and other oppressed populations. It's the framework that can lend to the practitioner an heightened understanding of issues. The issues of institutional and structural racism within the mental health system. How many times have clients been turned away from seeking or having access to health care? Or prevented because there are no providers in the area and they can't get to providers because they don't have the resources to get there. Do you know during COVID-19, I don't have the exact data, but significant numbers of Blacks and other minorities were turned away when they presented in the emergency rooms, when they presented to try to get treatment because something they knew was wrong. So it is with this heightening understanding that we as practitioners can take critical race theory and we can use it to illuminate the ways in which therapeutic progress can be complicated and the practice impacted despite the best intentions of critically engaged clinicians. There's serious trust issues, lots of hesitations. So with critical race theory, what we're looking at integrating from the perspective of intersectionality, which is an approach to the multidimensionality and complexity of the types of oppressions and how to address multiple forms of inequality in different contexts. You can think of intersectionality as a way of examination of race, sex, and class, national orientation, and sexual orientation. And then how does that integration and the combination thereof play out in various settings? An individual's identity and experiences are not limited to one aspect of their social location, such as race. But there are categories like gender, sexuality, nationality, religion, traverse, and influence their social reality. Now, Crenshaw talks about this, where she emphasizes the importance of analyzing social problems fully to comprehensively understand the nature of social inequities. And so the process that creates and sustains them is what must be understood. And that framework, looking at the tenets of critical race theory, illuminates this. So when we do this, it helps discern how the lived realities of our clients are shaped by different factors, and then how the social dynamics and those social factors operate together. So we have to listen with empathic attunement to the client's narrative. Let the client tell us their story. Don't assume you know their story. Listening to the narrative as a method of telling the stories of those people whose experiences are not told. And oftentimes are not asked. The lived experiences that come out in the personal narrative of the oppressed are narratives in critical race theory. And they are a critical tool to undermine dominant discourses. And also in opposition to dominant narratives, such as counter narratives. So these lived experiences of one individual's stories of resistance, which can be expressed implicitly or explicitly in relation to the dominant society's narrative. It's important for preserving the history of marginalized groups. We need to hear and understand and use their stories as references as we move on and take in more clients, because now we have a background of some understanding. Because marginalized groups often experience delegitimatization. They are delimited. Oh my goodness, delimitized. I'm messing the word up, but you get where I'm coming from. Next. So, Freud, and I'm a psychoanalyst, so I do pull on Freud. Frantz Fanon is first, though. Freud and Jung and other founding fathers were crucial in establishing the basic theories and practices of contemporary therapeutic care. But Kennedy and Waite emphasized racial differences. They weren't thinking about racial differences. Others, such as Carruthers and Kapoor, they argued that Black and ethnic minority patients were not psychologically sophisticated. Really? That they represented their illness in physical and somatic ways. And what they found it difficult to express themselves verbally in a way that was consistent with psychotherapeutic model. So within, even from the founding fathers, we see some very serious problems of how the other is viewed. But then came Frantz Fanon. He changed that narrative. He put it right out there. If you haven't read Black Skins, White Masks, please do so. Next one. So from 9/11, race and psychology have been even more inextricably mixed with governments, social institutions, mental health professions collaborating together to redefine the theory of mental health care. Here in the School of Social Work, here at the Mecca, we are looking at and redefining, and I engage you to do the same. How do we look at mental health in our communities, and how do we adjust our practices? We are obliged to do this. Given that race is a fundamental consideration in critical race theory, it's important to have basic understanding of how racism is typically enacted in the context of where the treatment occurs. Namely, the present day in a profession that is predominantly white and where institutions were primarily white. So Sue, that talks a lot about microaggressions, he addresses the harm that results in a cumulative effect. These cumulative effects negate the client's lived experiences, and it only serves to dismiss and undermine the client's experience, which potentially leads to clients disengaging in services. How many of us have come to us, our clients, or our clients come to us and they tell us, well, I didn't go back. I didn't go back to treatment because they didn't understand me. I didn't feel comfortable. Next. So I want to share with you a case from practice. And I want to engage you to think about, it's not the right name. Of course, I had to change the name. Think about this client. I wrote about this case in a publication called The Interpsychic Experiences, or the Interpsychic Binds of Race and Poverty. Euphemia is a 46-year-old African-American male from New Orleans. The lower Ninth Ward, if any of you know about New Orleans in the lower Ninth Ward, you can get a conceptual picture. His trade is food preparation. Specifically, he was a chef at a federal building. And since 2005, Euphemia has had one quadruple heart bypass and has also been hospitalized for suicidal ideation twice in 2012. Given his health challenges and his displacement as a result of Hurricane Katrina, he found himself in need of social service support for job placement. In his intake, he told the social worker that he feels like he is being shut down by the system that he helped build. He said that in New Orleans, he escaped gun violence. as a child and has buried a daughter and one grandchild from gun violence. He said he lived the life so they didn't have to. He survived Katrina and moved to Utah after the storm, and then chose to relocate to Washington, D.C. for the benefits. He said that he became isolated from his family because they did not understand that he feels stuck. Even though he's been able to relocate, he believes, in contrast to his family members' opinion, he witnessed disasters all of his life, and he is tired of being his own rescuer. Adding to this, he told the intake worker that he's not able to find a good job, even when he tries, because people don't want to call him by his name, Euphomia. Nor do they want to hire him because of his Andrinka symbol on his neck. They don't understand that I changed my name like the Panthers did in the 1960s because I felt like I was more than Jimmy Lee Jr. I felt like Euphomia embodied where I wanted to push myself past what I saw. I wanted to get away from the caged thoughts of the people in my neighborhood and do better. So I went to trade school. I got a good government job. You heard about those good government jobs. So he got a good government job and he worked for 10 years. Then he retired and Katrina happened. Now I've gone back to what I worked 10 years to escape. People don't want to see me. They don't want to see that. They see the tattoo on my neck. They see my age. I'm a black man with locks. And they assume that I've always been broke. They don't know that I just feel broken. So here are some questions for you to consider. How has Euphomia's lived experience informed his self-concept? How does his demography situate how society views him? And what's the praxis between self-concept and the embedded narrative of trauma? Given the historical context of trauma, how do we illustrate how race and poverty are embedded in his personal narrative? What biological, psychological, and physical, emotional, familiar, and racial factors contribute to his help seeking during this intake? And in what ways, if any, does the discourse of resilience permeate through the lens of his interpsyche? Or does his admission of brokenness exacerbate his former social practice? So I don't know if we get it in the chat. Are there any comments that can come through the chat? I don't see any comments, but I would encourage you to think about Euphomia. To think about the fact that his lived experiences, the context of his experiences, are important for us to understand. But you know what? We have another principle of the Black perspective: resilience. And there is a discourse of resilience for all of our folk because they survive. The strength perspective, another principle. Our folks have strengths. All you have to do is go through our history. Harriet Tubman and the North Star. If the North Star drove her from where she was in Georgia and others from the being captured and as slaves, that too is embedded in our genetic DNA. Whatever it was that strengthened her from that North Star, that strength is within us. Our clients have that strength, regardless of the scenario that they may present. Next slide. So people of color, and particularly African Americans, we've experienced exposure directly or indirectly to the unforgivable crimes of racism. The crimes of dehumanizing institutionalization of slavery, the oppression of the post-Jim Crow world, police brutality, and the excruciating effects of racism and segregation. We all have experienced that. These experiences, these memories, and these vicarious traumas that are experienced, and the narratives that are associated with these emotionally injurious experiences are embedded in all of us as African Americans and other persons of color. The detrimental psychological effects of these internal events, the internalized experience, can only serve to further oppress. Internalized oppression has been found to be the cause of psychological and emotional pain that correlates with a gazillion health problems: domestic violence, depression, and PTSD. Next slide. Next slide. So African Americans who live...
Dr. Barry Edwards.
Huh?
2 minutes.
Thank you. African Americans who lived with this traumatic history are vulnerable. And in the DNA, as I explained to you, since slavery, it's transmitted in their DNA to subsequent generations. It comes from the narrative process of the trauma and the observation of the traumatic reaction. We all had that observation, and we were all traumatized when we saw Brother George Floyd with a knee on his neck, crying for his mother. As with the interpsychic binds, the psychological development of race also has a significant interpsychic effect on the individuals. The experience of being a particular race and being subjected to racism as a Black person is real, and it manifests as we travel through life. Next slide. So poor African Americans are more likely to experience psychological distress. Racism can traumatize, hurt, humiliate, enrage, confuse, and ultimately prevent optimal growth and functioning of individuals and communities. This is a direct quote from me from one of my publications. And it is this persistent experiential transaction that serves to have only detrimental effects and lodges in the interpsyche of the individual. Next. Did I make my 2 minutes?
Yes.
Professor Wilbon?
Yes, you did.
Okay, I'm going to turn it over now to Professor Wilbon, who will take questions and answers.
We actually don't have time for questions and answers because there's 10 seconds remaining. We appreciate everyone for your participation, for your comments in the private chat and the Facebook comments section. We appreciate you being in this dialogue. Again, if you have any questions, put them in the chat. We will look at them and figure out how we can be able to get back to you. Dr. Barry Edwards, I'll turn it back over to you.
Thank you so much. And we look forward to hearing from you. Take this with you in your practice. I hope this is embedded in your interpsyche.